wake up gasping for air. Sleep apnea in seniors. Imagine waking up feeling more tired than when you went to bed. You might be experiencing sleep apnea, a common condition that disrupts your sleep and steals your energy. Don't worry, millions of seniors face this, but it doesn't have to control your life. This video will be your guide to understanding and managing sleep apnea, regaining restful nights, and waking up feeling refreshed. Stay tuned to discover sneaky signs of sleep apnea in seniors. It's not just snoring. Serious health risks you might not know about. Simple solutions to get back to sleeping soundly. Keep watching to learn how to finally solve sleep apnea and reclaim your energy. Sleep apnea in seniors, a guide for understanding and managing. What is sleep apnea? Sleep apnea is a serious sleep disorder that affects millions of seniors. It occurs when your breathing repeatedly stops and starts during sleep. These pauses in breathing can last from a few seconds to several minutes and can occur multiple times per hour. Symptoms of sleep apnea in seniors. The symptoms of sleep apnea may be different in seniors than in younger adults. Some common symptoms include loud snoring, witnessed pauses in breathing during sleep, excessive daytime sleepiness, EDS, insomnia or difficulty falling or staying asleep, morning headaches, difficulty concentrating or memory loss, irritability or mood changes, frequent urination at night, sexual dysfunction. Prevalence of sleep apnea. Sleep apnea is a common sleep disorder, affecting approximately 2% of the general population. The prevalence of sleep apnea increases with age, affecting about 10% of adults over the age of 65. Men are more likely to have sleep apnea than women. The prevalence of sleep apnea is also higher in people who are overweight or obese, have a family history of sleep apnea, or have certain medical conditions, such as high blood pressure or diabetes. Risks of untreated sleep apnea in seniors. Untreated sleep apnea can lead to serious health problems, including high blood pressure, heart disease, stroke, diabetes, obesity, depression, increased risk of accidents. Risk factors for sleep apnea. Obesity, large neck circumference, family history of sleep apnea, alcohol use, nasal congestion, allergies. Diagnosing sleep apnea in seniors. If you suspect that you or a loved one may have sleep apnea, it is important to see a doctor for diagnosis. The doctor will perform a physical exam and ask about your symptoms. They may also order a sleep study, which is a test that records your breathing and other bodily functions during sleep. Treatment options for sleep apnea. There are several effective treatments for sleep apnea, depending on the severity of the condition. Lifestyle changes. Losing weight, avoiding alcohol before bed, sleeping on one side, elevating the head of the bed, using nasal decongestants or allergy medications. Oral appliances. Oral appliances are devices that fit in the mouth to keep the airway open during sleep. They are typically custom-made and can be effective for mild to moderate sleep apnea. Continuous positive airway pressure, CPAP. CPAP is a machine that delivers pressurized air to the nose through a mask. The pressurized air keeps the airway open during sleep, preventing breathing pauses. CPAP is effective for moderate to severe sleep apnea. Surgery. Surgery may be an option for people with severe sleep apnea who do not respond to other treatments. The goal of surgery is to widen the airway and improve breathing. Choosing the right treatment. The best treatment for sleep apnea is the one that is most effective and comfortable for the individual patient. If you think you may have sleep apnea, it is important to see a doctor for evaluation and treatment. Tips for seniors and loved ones. Encourage seniors to get a sleep study if they have any of the symptoms of sleep apnea. Accompany seniors to their doctor's appointments and participate in the decision-making process. Help seniors use their treatment devices correctly. Monitor seniors for any changes in their symptoms or overall health. With proper treatment, people with sleep apnea can improve their sleep quality and overall health. Support for seniors with sleep apnea. If you have sleep apnea, it is important to seek support from your loved ones, doctor, and other healthcare professionals. There are also several support groups available for people with sleep apnea. These groups can provide you with information, support, and encouragement.